So our task, in order to get out of here today, we need to hear the report back from 4 different groups. They get 6 minutes or less each to summarize the takeaway from each of their sessions. We're going to go a little out of order because it's based on the availability of the slides coming back from each of the rooms. So the first group up is going to be Pete and Patricia. No, sorry, Miguel. I've got it wrong already. Miguel.
All right. Well, in our group, we were bringing education and practice accreditors together for achieving quality, quality being the operative word here, throughout the education and practice continuum. And we considered 5 questions. The first was, what are challenges in engaging the entire continuum of learners' organizations in the accreditation process? So engagement. And some themes that came out of this discussion were compromise, incentivize, unburden, words matter, and more specifically that we have the capacity to influence versus control what happens in accreditation, and that we really need to give accreditation bodies as a whole to get them agree and then add to practice. And how do we allow them to actually innovate while still being able to regulate to some extent? We also talked about incentives, that we need to incentivize more our accreditation bodies to work across their boundaries, to get out of their silos and work with each other and try to unburden the large numbers that we have to manage in this process. Last, we talked about words, that the words such as can and should and must. Our language is very, very powerful, even in the words we choose, and we should think about that as a challenge in engaging other professions when trying to share these competencies. And last, this requires leadership. It requires the consideration of money, 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 sharing revenue, and knowing and understanding the differences in the systems. The second question we looked at was, how do we align the requirements of accreditation standards with the accreditation programs? And we reworded this to be more the alignment of education and practice requirements in accreditation. And the words that came out of this were consensus, calibrate, find commonalities, and again, money came up. So you have to start from an informed beginning and actually come up with a consensus. And we can certainly find common ground. Maybe there is a 95% of core competencies that we share amongst various accreditations that are within our profession, and then use the 5% that maybe we don't agree on to argue about later. And certainly public availability of information to ensure that there's buy-in. We have to actually ask what the public, what our patients think when it comes to aligning education and practice, and certainly listening to the communities of interest when we do this. A big theme that came out of all of these was the gap between accreditation of practice and the accreditation of educational programs. That was a theme throughout. The third question we asked was, how do we prove the worth of accreditation in protecting the health of the public? And again, things that came out of this were value. What are the outcomes, whether it's getting a good job, having good performing colleagues within our practice environment? And then the idea that we can't do a randomized controlled trial. We're not just going to remove accreditation and see how many errors occur. And then last, access was a very important comment that came up during the session, that we have to be mindful of not just what accreditation does to promote safety in those programs that are in fact accredited, but what's the impact on a community if we were to in fact shut down a program, and how that affects care of patients in that community, especially if it's one in need. The fourth question was the future of education and accreditation balance across the world. And what came from this were thoughts about the shifts in demographics, not just amongst the heterogeneity of practice sites and practices and culture, but also retired workforce, losing workforce across the world becomes less effective, and we have less of a critical mass. Certainly the shifting nature of roles, that in your health profession today, that profession may look very different 20 years from now, and how do we evolve along with that? And then last, that perhaps there's the term international standard, maybe it's an oxymoron. Maybe there really can't be a standard that fits every possible situation. We have to be mindful of that, even though there will be commonalities. And finally, the last question we addressed was, how do we best partner with patients, populations, communities, and governments in promoting the role of accreditation and ensuring quality education and training? And we thought we have to refocus what accreditation is truly meant to do. Go back and think of our core principles and why we started doing what we do. And that we shouldn't force ourselves on anyone, that we should work with the willing first, start there and look for common ground, and that our motivation should be related to the populations we serve and not merely self-serving interests. We should think about joint commitments with other professions, and also look to other fields outside of the health professions, whether it's airline industry, maybe it's information technology. What do other industries outside of healthcare do? What are their best practices, and how can we actually build on those within our own accreditation practices? Thank you.
I think we have like 1 or 2 minutes left of Miguel's time. Does anybody have any questions or points of clarification before we move
Anybody in
on?
the group wants to add to what we discussed, that would be fine.
It was so clear. Okay.